With the fact that we are refugees hosting region or districts, we have a lot of issues here, and particularly the issue you came to address, that is menstrual hygiene management, is a very crucial issue. And given the low level of income of our communities, it has been very expensive to manage, and it has always led to a lot of infections due to poor management of the menstrual hygiene. Now, the product you have brought really is something which can be a good solution to this problem and the challenges. Well aware that our community have low income base, given the fact that this is a product which is very cheap in the long run and very durable. It can take up to 10 years. It is really something which is a big solution to the challenge of income, and it is affordable.
When we set out to do this project, it was looking at how can we empower individuals, how can we empower our champions, well beyond just menstrual health and hygiene management, but also looking towards their financial stability. We were able to offer trainings on financial management as well as sensitization and learnings on menstrual health and hygiene management. With this information, they were able to be empowered, and with that, they were able to empower their own communities. Not only with information, but also guidance in relation to managing their finances as individuals.
Our key anticipation was to have the girls and women sensitized. The other was to have the costs reduced for the girls to be able to enjoy their menstrual periods as opposed to before, where they had challenges of thinking of how much their pad would cost, how much the water, and so many issues that come with the refugee environment. We have had a lot of sensitizations alongside them, MHM sensitizations. We have had to train our champions on how to also preach about gender sensitiveness, gender roles, and how men can support the women during their menstruation.
The champions were made up of different individuals, including village health team members, including women leaders, and also including members of local village savings groups.
We have registered several achievements for the test project, and for a start I would want to emphasize the role of partnerships and the partners we have achieved and gained in Adjumani especially. We have had the chance to interact with the partners that have mentored us, use their structures for our several achievements. If you look at the girls we have been training and working with, because of the results of the partnership and the synergies that we got from Adjumani partners. A range of partners including Adjumani District local government, Office of the Prime Minister in Adjumani, UNHCR, Northern World Federation Uganda. We initially had the fears that the men would not embrace the test project in Adjumani. But our second achievement has been the men embracing the project and the men loving the project. Men were having a smile on their faces where they have had savings.
I think that the project has worked well to change people's attitudes and communities' attitudes towards menstrual health and menstruation in general. The project has also worked to change people's attitudes towards gender equality. When we had the trainings that offered financial training as well as menstrual hygiene management trainings, it gave the women champions that we trained an opportunity to take lead within their lives. Not only looking at the selling of the Bfree cup, but also looking at how they can be financially stable as women. As public health ambassadors Uganda, we've also seen a lot of growth as an organization. This partnership has allowed us to be able to spread our roots across the country. Working with the Bfree Cup does not only end in Adjumani District, but we've had other people also express interest in working with us, in wanting to use the Bfree Cup. and we've had a lot of adolescent girls and young women that are showing heavy interest in it across the country. One of the major challenges that we faced for this project was the COVID-19 pandemic. For an individual, for a champion to be able to reach out to people within the community, it takes a lot of convincing, because this is a menstrual cup. It's not an ordinary menstrual pad that people are used to. So it takes time for someone to convince another one to switch and start using the cup. But with the pandemic, it held back access, the access that the champions had with the people within their communities.
The last test results, the survey indicate that the project has been embraced in Adjumani. So it's up to the donor to make sure that the scaling up is done in Adjumani. Otherwise, there are several other chances of having a scale up elsewhere in the Adjumani District or to Kampala. But I would feel and support that the scale up is done in Adjumani, because there is potential for market. We have only touched a smaller percentage of Adjumani. There's a lot we still need to do in Adjumani.
We look forward to seeing this grow beyond a project, but into a lifestyle that can impact the lives of all the girls within Uganda.